Welcome to Locally Sourced. I'm Armanda Famiglietti. And tonight we're going to do another episode with the CoveCare Center here in Putnam County. We're going to take a closer look at alcohol and substance abuse with two of their dedicated staff members. Welcome, Liza. Liza, what's your last name?
Szpylka.
Szpylka, sorry. Liza Szpylka and Arlene Seymour. Great. Thanks so much for coming, and I'm sorry I flibbed on your name. So Arlene, I'm going to ask you, tell me about the work that CoveCare does in general, and specifically in alcohol and substance use.
So you're asking me the question about the general work. CoveCare is very much a person-centered, treating the whole person agency, and we have so many programs that will address that. In the substance use program, we're able to collaborate with all the other programs in the agency to treat the whole person. What we do is it's an outpatient program, non-intensive. We have groups and individual treatment, and we do assessments for Department of Social Services, CPS, court, DWI. What I try to do in that program, and I've been successful, is that we only have master's level mental health and substance use counselors. Mm-hmm. So we can deal with the co-occurring disorders as well.
And what do you do there?
I'm the director of the substance use treatment program and the prevention program, and recently the Family Navigator grant as well.
Wow. So you mentioned what CoveCare does specifically in the area of alcohol and substance abuse, but it has a much broader mission, right? Can you talk a little more about that and maybe a little bit about its background here in Carmel?
Lisa, you might be better at that one.
Sure, Lisa, yeah. You want to take it?
Sure.
Yeah.
Well, actually, one of the things that I do in my position is to make sure that the mission of our organization is really upheld throughout the whole agency and the whole organization. And it really is to partner with individuals in their recovery, whether it be from substance use or mental health or even economic challenges or social challenges. We've been in the county for over 20 years. We were formerly Putnam Family and Community Services, but we rebranded to CoveCare to have a broader base, not just Putnam County, but also any of the surrounding areas. These are
Westchester,
Dutchess. These are issues that can impact anyone, and regardless of where their economic status is, their social status is, their age. And we really just try to provide whatever services we can help to help people progress and improve their life in any way that they feel is necessary to do.
Wow, that's a broad mission. So tell me, what do you do specifically at CoveCare?
Well, I'm the Vice President of Behavioral Health, so all the clinical programs are basically under my auspices. So make sure that they are meeting the standards of clinical care that we aspire to, that we're in compliance with all the regulations, which are numerous, unfortunately, in this field, that we do look at everybody as a whole person and not just one aspect of what's going on in their life. And also to make sure that we're doing it in the best business practices possible so that we can sustain ourselves going forward.
So you've been in the community for a long time. How have you seen it change over the years, especially relating to alcohol and substance abuse? And either one of you can answer that question.
Well, what I'm seeing lately is an increase in marijuana use. And I would imagine because of the changes in perception.
Because in some places it's legal to use it?
Right. The perception is it's not that dangerous, and in fact it is, especially with the younger people, because it affects their brain development. So we're seeing that, but we're also seeing a lot of alcohol. I was looking at statistics this morning, my numbers, and I saw 55% of our clients from the beginning of the year until now identified alcohol as their primary substance.
Wow.
Yeah.
So I'm surprised with that answer. Actually, I didn't know what the answer was going to be.
Yeah.
But I thought you were going to say it was opioid and heroin use. But you're saying it's marijuana and alcohol, the old favorites.
The old favorites.
The golden oldies.
What I see is people sometimes identify opiates as their drug of choice. I would say I'm looking at 25-30%, but more so they're not going to say they have a problem unless I get somebody in who has a problem with heroin. If it's opiate pills, it's more usual that they don't think they're abusing them because they might have been prescribed them originally. Mm-hmm. I'm also seeing, just to the side, this is very interesting to me, some cocaine.
Really?
Mm-hmm.
Okay. That's coming in now too?
Yeah.
Okay. So you say that they tell you what their issue is, right? So so much of what you're hearing from the people who seek help, they're self-identifying as to what the issue is. Do you think that there's less of a stigma if you say that you have an issue with marijuana and alcohol than if you say you have an issue with heroin or opiates?
I do believe there is, yes, absolutely.
So do you think that some of these people might have issues with heroin and opiates, but are maybe sort of, making it sound not so bad if they say alcohol and marijuana?
I believe they do that, but we will eventually find out what the issue is because we do drug screens that are sent out from our lab. So if the person has a problem with something else, the drug screens are very thorough when they're returned, and we can see if they're taking medication that's prescribed, if they're not taking medication, or if they're using whatever they're using.
But in all the programs you do, you kind of start with where the person is when they come in to talk to you. So Arlene, what is CoveCare's philosophy and approach when working with, it dovetails with the question I just asked. What is your approach? You meet them where they are?
Well, that's actually the best way to describe it. We believe in a person-centered approach, which means that the person is really the one who drives their treatment. We're there to make sure they have all the information, that they can make the most informed decision that they possibly can, find out what their hopes and dreams are, where their goals are, how we can best accomplish that. And, it's unfortunate when you talk about what we're seeing, the fact of the matter is, there's no drug that we have not seen in our substance use program. It's just the amount of substance use, and opiate is still an issue in Putnam County, of course. It's still impactful of everyone's lives.
Right.
And we're also including nicotine in that as well.
Oh,
as kids are more and more vaping.
Right.
And that's a trend that we've started to see more significantly over the past some odd years.
Would a young person come in and say, I'm alarmed by the amount of vaping I'm doing? Is that how you say that you see nicotine abuse, but are people coming in and saying, I think I've gone too far with my, what's it called, Juul? Or?
Yeah. That's not usually the kids, it's usually the parents
Oh,
bringing the kids in.
All right,
Yes.
okay. And they say, my son has gone or my daughter's gone too far with this.
Well, vaping is not just nicotine, it's also THC. It's marijuana as well. And they're doing it in the classrooms. They're doing it in the bathrooms.
The bathrooms of the schools.
Let's back up a
Yes.
little. In the schools in Putnam County,
Yes.
you're saying that there are students who are in the classroom are vaping marijuana or THC, the part of marijuana that works to do
alter
your
you wouldn't
state.
know. You wouldn't know because the Juul is very little and thin. It could look like a pencil, and they're pretty colors, and so you wouldn't know.
Is it possible that parents don't know that their kids are using Juul?
Absolutely. There's an effort by prevention called Hidden Mischief, and it's an interesting name. It's a teenager's bedroom setup with their backpack, their books, their clothes. It's like a regular kid's bedroom, the pile of clothes on the floor, that kind of thing. And within all of those things, there are maybe 50 items that are drug-related.
What?
And so it's a training for parents to go through the bedroom, or participants to go through the bedroom and identify those things. You can have a pen, open up the pen, and there'll be something in it. You wouldn't know. You will think your child is not doing anything, but you have to look. You have to really look.
Okay.
And talk to your kids.
Yeah.
Yeah.
So it's all done on the sly. It's all sort of secretive on the part of the kids in the classroom and at home.
Which is,
I almost have to be a detective if you're a parent.
Well, I
or
don't
a
think
teacher.
I don't think it's different than it's always been. It's just taken on their new names, their new substances, new behaviors. It's the same thing. It's, as a parent, you need to be communicating with your child,
Right.
and being aware.
And just speak openly, I guess.
Yes.
You know. So tell me, do you work more on the prevention side of the program or the treatment?
Depends on the need of the program. So I think right now I've been more on the treatment side. I've been doing treatment for most of my career, so managing outpatient clinics. But I work in both sides. Thursday I'm going to Haldane, has an open school night. We participate in those with the schools. We have a table, meet parents.
Parents and children come
Parents
to
and
those?
children, give out brochures. We have little giveaways for them as well.
Oh, terrific. So let's talk a little bit about prevention. So I know that the schools have always, since maybe the 70s or 80s, have had some kind of intervention trying to educate kids about drugs and ways to avoid them. You know, that, how role playing and that sort of thing. So tell me, you go to the schools. What kind of programs can parents and kids expect to get in terms of teaching them how to prevent drug abuse or alcohol abuse?
Well, our prevention program is, all of our programs are OASAS licensed, the New York State Office of Alcohol and Substance Abuse. So our regulations prescribe that we use evidence-based curriculum. So for the schools, we have two programs we're using currently, Too Good for Drugs and Too Good for Violence. The Too Good for Violence is my favorite right now because we're really looking at behaviors. It looks at bullying behavior, the behaviors beyond the addiction or beyond the use, because that is really the addiction or the use of the drugs is just a symptom of many things that are underneath.
Okay, I see.
Yeah.
And so the parent not only has to sort of figure out whether or not the child is moving towards drug use and alcohol use, but also what the underlying issues might be with that child.
Absolutely.
Is there always an underlying issue? Is it ever just because of peer pressure? Is it ever just because the kid is a kind of kid who is adventurous and experimental and wants to know what all the fuss is about drugs?
Sometimes it starts like that. In prevention, we talk about resilience, and people are born with a different amount of resilience. So that one
resilience
child
to peer pressure,
pressure, to outside influences, and genetic factors as well are a big piece of addiction. But you have a child that will experiment once and say, I didn't like this. And then you have another child that is feeling a little bit of social anxiety perhaps, and they'll experiment more and more. And they don't have that self-esteem and that resilience to stop that, which is what the Too Good for Violence kind of addresses.
Right, I see. So what you're saying is that it might be natural to experiment, but there may be a genetic predisposition to some of those experimenters actually becoming addicted. Is that how I'm hearing this? Okay. And so, boy, if I don't have any children or I'm not a parent with kids in school, but this sounds very, very frightening to me. So it's really important the work the organization does to educate people. In fact, you brought along a video, and we're going to run that in a minute or two. So, but in the meantime, while they're getting the video up, tell me how people can reach out to you. What's the best way for parents and children or anybody who thinks there's a problem with alcohol or substance abuse to reach you?
Well, we have our website, and I think that's a great place to start looking for in terms of information.
And we have, probably all the information people need on the screen right now.
And specific for the substance use program, we just started a new program in partnership with Drug Crisis in Our Backyard, which is a family navigator program. So there's a number that you can reach to speak to someone who can help a family member who may have some concerns, whether it be their child or their spouse or even their parents. Because substance use is not just about children. It's we're finding a lot of substance use among seniors. We're finding a lot of substance use for people with chronic health conditions, because that's a way to manage pain or what have you, which turns into addiction, which is impacting their life. So the family navigator could potentially help them to get the information that they need and make sure that they have the resources available to potentially help whoever their loved one might be.
And it's interesting you mentioned that and Drug Crisis in Our Backyard, because our next show is going to be an episode featuring Susan Solomon and Lillian Newman, who actually have a program here on Comcast Channel 21, and they talk about a lot of these issues. They're, they're really a great couple of ladies. So stay tuned, and the next show is going to be a lot about family services for people who suspect, who know that someone in their family, whether a child, a spouse, a parent, is having issues with alcohol or substance abuse. So I'm just going to wait to see when the video is ready, and I think it's coming up right now, so let's watch.
We're really excited to have CoveCare as one of our partners in the war on addiction, whether it is alcohol addiction, chemical dependency addiction, opioid addiction. They've been a great partner in the school districts with some of their prevention programs. They're part of our Communities That Care coalitions, which are out there in each of the communities, which is important to recognize that as a partner, each of those communities, their services are available then for those communities. And what's really, really exciting is that from the beginning, they have been our partner. And as services continue to grow for those people with addictions, so does CoveCare. And though the addiction is devastating to families and the community, it's nice to know there's a place for them to go like CoveCare.
That's terrific.
Yeah.
So that man, tell me who that man was and what he does and how you partner with the county.
That's Joe DiMarzo. He's the Deputy Commissioner
For Putnam County.
For Putnam County.
For mental health,
Youth
Board, and DSS.
Yeah. DSS?
Yes. They're commissioners of Department of Social Services.
Oh, thank you. Okay.
Yes, yes. So I am a member of a few of the Communities That Care coalitions that Joe mentioned, and I'm also on the drug court team with him, which is very interesting. And we have a provider meeting once a month that Joe holds, all the substance use providers, which are few, but we all get together and talk about our programs and how we can work together and what's new.
Okay. So, and do you work with Joe, you work with Putnam County? Are there other organizations? You work with Drug Crisis in Our Backyard?
Oh, actually, that is one of the most wonderful things I think about Putnam County, is that we are all working together and we are all in partnership with one another on some level to meet the needs of the community, whether it be with us or the county officials themselves, other organizations. We really work very closely and very nicely together, and that's, I think, unique to Putnam, because we're small enough that we're able to do that, but yet offer a great deal of services to the community.
So have you seen over the years, you've both been with CoveCare for a while, an increase or a decrease? What's happening? Are more people coming to you for help or less?
I've only been here for 3 years. It'll be 3 years now. I'm seeing a little bit more since I've started, and many more with co-occurring disorders. That's.
Tell me, there's a slide on the screen. Tell me what's happening in that slide. Why should we pay attention?
Oh, I can't read it.
Can you read it, Liza?
Well, that is just an advertisement for our substance use program, and it does talk about that we're fully licensed, of course, and that we're here to help.
So that picture is, I assume, I'm going to guess, that's a mother and a daughter. Either one of them could have an issue, or both.
Or both, yeah. Yeah.
I think our climate is certainly such that we're seeing more people who are feeling less stigmatized, I should say, and more willing to accept the additional assistance, whether it be mental health or substance use or just some additional services for their child. I think we live in a very stressful time where social media certainly adds a lot. And I think people are more willing to recognize when they might need some additional help.
Well, that's good news.
I think so.
Yeah.
So is it then that more people are willing to come forward and say, I have a problem, or someone I love has a problem? Or is it that more people have problems? Or is it both?
I think it's a combination of both. And to piggyback on what you said, I'm seeing more people coming in that are actually self-referred.
They recognize
the
issue in themselves.
A rarity.
That's terrific news.
I've had some people college age realizing they drink too much. I've had older people realizing they have a problem with the pain medication, that they used it after they didn't have to, weren't prescribed. You know, they're realizing they have a problem and they want to get back to controlling their lives.
That's terrific.
Yeah.
So I do want to mention, we talked about alcohol, substance abuse, but what we hear in the news is the opioid crisis and the heroin crisis. And there are certain medications available that can really help with that, right? Can you talk a little about those medications and if they're the same ones that are they able to be useful across the board from alcohol to heroin?
Well, currently we're prescribing buprenorphine, Suboxone, so we don't start people on that, and that is for opiates only. So
and what does that do?
It is a partial blocker, so the person takes it, they don't have the craving to use.
Okay,
and
so it helps with withdrawal?
There is no withdrawal when you're taking it.
Wow, that's great.
Yeah, you have to be able to, at the point, there's a certain point, they have a scale that they look at, that they rate before they will prescribe, but we don't start people on it, we continue them on it.
Okay.
And
it's actually a new service that we provided over the last 3 or 4 years. We had not traditionally provided this type of medication-assisted treatment. So that was a trend that we're seeing in the community, that people who are addicted to opiates need that level of intervention in order to stay off the opiate. So you can have it, you can not feel the effects of heroin or potentially overdose, but not have the sickness that often accompanies with opiate withdrawal.
Wow.
And there are medications that we could use for alcohol. It depends on the individual if it's going to work out for them,
right.
But it is something that we offer across the board, really.
That's terrific. Are those medications expensive?
Most insurances will cover. They are.
But if you don't have insurance?
Then it can be.
Yes.
Okay, all right. So how do people who don't have insurance cover the need for this kind of expensive medication?
Well, if you have a heroin addiction, you're spending a lot of money to buy the heroin, so they could be very resourceful to ensure that they have the insurance. But, insurance nowadays, they're certainly eligible for Medicaid. Medicaid will cover it. If you're working, private insurance will certainly cover it.
Will Medicare? You said you had some senior clients.
I believe Medicare covers it as well.
Covers the medication, yes. Yeah.
Okay. What about methadone? That's sort of an old-fashioned drug. Are you still using it?
We don't do that in our clinic, but we certainly have clients that are using methadone that go to a clinic. Yeah, I just
so someone could go to more than one clinic.
They could go for methadone to a methadone purely a methadone clinic, but they can't be going to outpatient treatment and a methadone clinic and come to our outpatient treatment.
Okay.
That's like the same.
Yeah, that would be the same
Methadone
thing.
programs also provide treatment, but it's a different type of program, and that it's much more regulated and much more a lot more things in place for methadone.
Okay.
Yeah.
All right. That's very interesting. So not only may you have a substance abuse issue, but you also have to know how to navigate the system so you're getting the appropriate care. And if I came to you, you would help me navigate the system so I get the appropriate care. That's another service that you offer. So we're talking about sort of a dark subject here, but there is something that's happening in the fall. And it's something that happens every fall, the CoveCare sponsors. So tell us about the silver lining here that's happening, I think in October?
Yes, it's our annual Imagine Dinner Dance on October 12th. And this year we have the privilege of honoring our very own Diane Russo, who's been the CEO for the last 20 years, for her many years of service, not just with CoveCare / Putnam Family, but just in the field in general. So it's going to be a wonderful event. Get your tickets now because they are selling like hotcakes.
Oh, good. Yeah. Glad to hear it. We have Diane on the show, and she is fabulous. And, I know everyone, has to retire at some point. It's kind of sad to see Diane go because she's been such a force in the community. And so everybody get out there and celebrate Diane's terrific contributions to Putnam County and CoveCare. I can't imagine how many lives she's touched and improved in her career.
Exactly.
And it's going to be fun, right?
It's
a lot of
always
dancing.
fun. A lot of dancing.
You have a
Good
band?
music.
Band, yeah.
Who's
Good
the band?
food.
Good food, the auction.
Oh, no, that's right. You have a silent
That's
auction.
a huge, very
What
large
are some of the
auction.
prizes this year?
We always have vacations and sports tickets. Those are big sellers. And
The
the
Mets
venue
and the
is very Mets, Yankees, Giants,
yeah.
and the venue is very nice. It's at the Salem Golf Club, so it's a beautiful location.
Wow. Okay, so that's the word. Everybody, we'll see you all at the dinner dance in October.
Yes.
And thanks so much for coming. It's always you always bring such great news and important information when CoveCare appears. So thanks so much.
Thank you
Liza,
for having us.
coming. And
Thank you for having
and
us.
thank you,
Yeah.
Arlene. And of course, thanks to our volunteer crew who come faithfully and to the people who watch. Thanks. Till next time.